On to the next session, Government Initiatives and Regulatory Framework in Digital Health. Mr. B.G. Menon is a distinguished fellow member of the Cost and Management Institute of India. Under Mr. Menon's leadership, Acme Consulting has ascended to become the foremost healthcare quality consulting company in the nation. With a clientele boasting over 1,400 hospitals and labs, Acme's operations span over 14 states. Acme is the sole healthcare consultancy accredited by NABAT of the Quality Council of India, maintaining this prestigious accreditation uninterrupted for an impressive 14-year duration. May I now request Mr. B.G. Menon to please introduce and moderate the session.
Very good afternoon to everyone. There's been a small change in the program after we have discussed, because I've taken over the role of speaking on the NABH, and Mr. Sayantan of PwC would be moderating the program. But I'll be happy to welcome all the other speakers on. Mr. Vikram Pagaria, please, sir. Mr. Vikram is the Joint Director of the National Health Authority. He's come down all the way from Delhi, which gives a lot of importance to today's program. NHA has been driving the entire digital health across the country. Mr. Vikram is an officer of the 2010 batch of the Indian Revenue Service. He's been posted as Joint Director of Coordination at the National Health Authority. He's responsible for accelerating adoption of digital health in the National Health Authority. He coordinates with various private and non-government organizations to integrate the Ayushman Bharat Digital Mission. He also manages the information, education, communication activities for ABDM. Mr. Vikram is accompanied by Dr. Manivanan, again from ABDM. Mr. Manivanan is from the ABDM Tamil Nadu chapter, which comes under the Tamil Nadu Health System project. So I think he would be able to give us some more information about how ABDM is operating today in the country. And I also introduced Mr. Sayantan, who is a partner with PwC. And over to you, Mr. Sayantan.
Hi, good afternoon, everyone. It's always a pleasure and also a lot of expectations, especially when you come up from a startup session. Like, I really love the energy, the vibe that goes with a startup. So just to set the context of, I think we have been right since morning talking about digital transformation, some of the things that literally are not only in the future tense, but in the present tense, changing healthcare. So in today's session, what we'll try to focus, and if you really think about it, the bulwark or the vision literally comes from a government of India and our honorable, right from a prime minister, the health minister, to say that what is the vision that we as a country want to be basically embarking on, healthcare in, I would say, overall, and what are some of the specific measures, I would say guidelines, if I can use the term, which are towards a regulatory point of view as well, which are setting this entire concept of transforming the way healthcare is delivered, the healthcare is accessed, and more importantly, how healthcare is even looked at. So we'll be trying to cover some of these aspects, and we have on the dais, I would say, fraternity, which will really do justice to today's session, and I'll keep chipping in between in terms of what we are talking about. But the key message today is just to see that what is the overall guideline, the direction that we are going in, and get some insights that where we as a healthcare, as an ecosystem need to be aligning for. So maybe I'll just take my seat over there, so that's much easy to get into a conversation, and then we'll just try to egg the conversation there. Thank you. Okay. So maybe if I were to just set the ball rolling with regards to the first few things that is always on everyone's mind. And the biggest, I would say, initiative which the government of India has done, which is around ABDM. So I will like Mr. Vikram Pagaria to set the first, I would say, context and conversation rolling around few things. What is the vision that the government has? More importantly, how it is getting executed from a vision to a reality. What are some of the key things that we as healthcare ecosystem, I would say, stakeholders needs to be aware of? And very importantly, what's the way ahead? Over to you, sir. Thank you.
Good afternoon, everybody. Thank you, CII, for having us here. National Health Authority has been participating in a lot of conferences from now on, because we think that a lot of work is being done at the NHA as well as at the ministry, but it is also important that we should make available the information and seek feedback from the stakeholders of the kind of work that has been done. So just a little bit about the digital mission that was started in 2021. The national rollout was done in September 2021, and the intention of the digital mission is not to do everything in digital health. There is eSanjeevani, which is doing 5 lakh teleconsultations every year. There are different digital health initiatives in the reproductive child health program, Nikshep program. But what digital mission essentially does is promote interoperability. And to give an example of interoperability is that, suppose I go to a private hospital in Chennai, and after a month I go to, say, AIIMS Delhi, and if I give my mobile number or I give my health identifier, the doctor over there is able to see all my health records, provided that I have given consent for this. So if the patient gives consent, the healthcare provider is able to see all the records in her screen, in spite of the patient not carrying a physical copy. And why is this important and why is this revolutionary is because suppose you go to Apollo Chennai, and after a month you go to Apollo Hyderabad, you say your mobile number and all the records are available. But what the challenge happens is that if you go to Apollo and then you go to a different government or a private hospital. So just with this intention, the digital mission was introduced in 2021, and the mission is to create a digital health ecosystem. One of the main thing that that we find a major challenge when we implement this mission is that when it comes to similar digital initiatives in other sector, those sectors are slightly more digitized. For example, let's say UPI. UPI was introduced in 2016, and the digital ecosystem, all the banks were digitized. Right now, when it comes to, for example, in the previous session, it was also spoken of that the supply chain management presentation, very few hospitals have HMISs or hospital management information system, or very few hospitals have ERP software. So the level of digitization is still lacking. But in spite of that, one good thing is that if we have started creating, enabling, promoting interoperability from the very start, that the health system is getting digitized, we might not end up in the same problem that the US is facing right now, where there are a lot of silos that are there. So it is with this vision that we are operating. Yeah, and I can give more details as we talk.
And I think, as you correctly said, it's literally breaking some of the silos. And the example that we gave in is pretty much something which is fundamental to the vision that we spoke about. So there is a concept of what is known as UHI. Few of you might have heard about it, which is to say, which is like a unified health interface. Now, what it does is that if I'm a citizen of India, and it's a huge initiative that the government has undertaken, and we as Indians should all be proud about it, that if I'm a citizen of India, that 1.4 billion that I'm talking about, wherever I go, whichever health service I basically take, whichever care episode that I basically encounter, whatever drugs I may buy, whichever test that is there a way for it to be accessible for the information with me? And then whichever caregiver is basically delivering the care has access to it, obviously with my consent. Now, the entire thing that we are talking about may seem very intuitive. It's almost like, if I can use the term, very fundamental to that. So whether I'm born in a Chennai or a Calcutta, I'm staying in a Delhi or a Bangalore, the unique health identifier, which is what we call as ABHA, becomes my, I would say, the passport or the entry for me to be leveraging this. And think about the revolution that I don't really need to care about or even remember. See, all of us are very particular about having our medical case history. I've seen my dad and my grandfather maintaining whatever they had. But think about it, if it is there with you at the click of a button on your mobile, which all of us are, and we have literally shown, in fact, the mobile revolution showed that we are all very tech savvy in that, that's what we are looking at. And the biggest parallel think about it is UPI. When I remember when UPI was getting launched, everyone thought that, hey, why do I really need to get about? We have a credit card, we have an NEFT, but that's exactly the part of things that we are talking about. It will have its detractors. It will have some people who will basically think that whether it's the right way, but trust me, this is the way that we have chosen as a diaspora, and this is the way we are being. And one of the key things out there that we are talking about is the entire security aspect as well. So we'll cover that, what is there on the mind. I'll also try to get Mr. Menon in about another very key initiative. See, what today's session is all about to say and make all of you aware of some of the things that's happening is the entire, I would say, initiative which has been spearheaded by NABH. All of you would have heard about NABH as the accreditation body, about a digital health standard that got launched on 17th of September. We as PwC were privileged and humbled to have contributed our bit in terms of developing that along with NABH. So that's another vision in terms of how do we improve the digital maturity of all the providers we are talking about. And we don't differentiate whether it's a public sector or a private sector, whether it's a 10-bedded center or a 1,000-bed multi-speciality, super speciality, multi-chain. The whole initiative is that how do we bring the entire maturity of all the hospitals up? How do basically we tell every organization that, hey, this is what you want to be doing in digital. This is where your roadmap would be. So I will let Mr. Menon talk a bit about it, and over to you. Thank you.
Thank you, Sayantan. Because this is predominantly a hospital audience, I'll just request the slide to be put on, which is a quick recap of what the NABH Digital Health Standard is all about. Because I know it just come out about a month and a half back. So there could be a lot of concerns among hospitals on, is this a new standard that we've now got to get into? And then I'll give you some of the reasons why it's mandatory. We'll just quickly run through this. Is there some way I can move this? As I said, it's just out about a month and a half back. Actually, October 5th was when the standard was officially out for everyone to view and comment upon. But now it's a final standard. So it's no more than a draft edition. 8 chapters. Anyone familiar with NABH knows that many of these are common with the NABH 5th edition. The first 3 chapters are absolutely title-wise the same. Same way on information management system, HRM. The 3 new chapters that are there in this are the digital infrastructure, vis-a-vis the facility management that was there in the NABH, digital operations, the new chapter, and finance and procurement. NABH never talked about finance and procurement till now. So this is the first time they're talking about that. Why, we will know. Quickly, just a few points on what comes under each of this. See, what is being trying to be achieved by the NABH is the standard is pretty much the same as the 5th edition. The hospital doesn't need to go through a fresh set of SOPs or anything. It's mainly on the implementation. The assessor would like to see that whatever we are talking about on the NABH 5th edition standards in the hospital is available in a digital form. They need to be able to see, they need to see proof of it running, they need to see the quality indicators being captured that way. So we have to look at each of these chapters from that point of view. So what does it say? It says that you need a unique ID for the patient. Yes, many hospitals do have it, most hospitals do have it, but now this needs to be linked to your ABHA, linked to your Aadhaar. For the same reason that Mr. Vikram said, somebody who is taking treatment here goes to Dhanbad for some reason, he needs to be able to get the record there, provided it's in the same panel group. And this needs to be quite comprehensive. Medical history of the patient needs to be a care plan. Everything that's there in a typical medical record of the patient needs to be available, digitized at the hospital itself. All radiology tests, all lab tests have to be there available. And along with, through PACS, the X-ray, the CT scans, imaging has to be available, which comes to the next point about having a good HMIs in place. And a full-fledged patient portal. Because right from appointment booking onwards, the patient engagement with the doctor, getting the reports while sitting at home, not having to go to the hospital once more, getting alarms on when the next appointment has to come. And through the patient portal, they're also engaging, they're asking the hospital to engage with the patient through wellness tips, using that also as a preventive health measure. So that way it's quite a far-reaching measure that they've got into. Care of patients, the basic clinical standard of the NABH, they want all of this to be captured digitally. So right from the nurses' rounds inside, the doctor's prescriptions while in the OPD, the assessment notes, the discharge summary, all the lab tests that the doctor would be referring to, everything needs to be captured digitally so that when this patient needs to go to the next hospital, this information has to be available digitally. Primary to the NABH's condition of continuity of care. You can't go to the next hospital and then the doctor starts them off on another set of tests, another diagnosis that has to be done, another consultation has to be done. This patient could be an emergency patient. Unless this data is available, a lot of precious time is lost before the patient starts getting the treatment all over again. We were hearing a case today of your experience in the US where getting this information itself took them nearly a day. And today we are looking at some like a cardiac arrest, just in a few minutes he has to be addressed. So whatever were his pre-existing conditions, where did he do the treatment from, should be available at a click of a button. Patients can't be expected to carry their patient files along when they go for a business trip. They would go when there's a planned consultation. So it moves a lot towards that sort of digitalized care. Management of medication, entirely the medicine, the inventory levels, the prescription that have to be there, entirely digital prescription that go to the pharmacy. By the time the patient reaches that should be available. There are many HMIs in the country which have this in place, but today you are getting a bit of it pushed from the center itself. So that makes a big difference. When ABDM talks about this and says that this is required when the hospital is got to be digitalized, there is a little more seriousness taken about this. I remember when about 12 years or 14 years back when the NABH came out, I think over the first 5 years, there must have been about 10 or 12 hospitals every year that went for the NABH. It's only when finally insurance came inside, insurance also started making a requirement that same 5 number jumped up to nearly about 500 every year. And today you have close to about 14,000 hospitals with the NABH. So this could be a big game changer the moment the Ayushman mission and the other public and private sector insurance companies also come on board. This entire speed of implementation will go up. Because like many speakers said in the morning, doctors are pretty averse to typing it out, putting it into record, putting it into their systems, especially when you're talking about case sheets and primary consultations. The digital infrastructure it requires needs to be standardized. The same document needs to be read across about 25 hospitals that this patient might need to go to, or he or his family need to go to. So it needs to have a URL system in place, it needs to have browsers which are standardized. The level of detail that has gone into the standards, I must compliment PwC and his team also who has worked with that, because it's got into very, very, very minute details. And for a hospital already having the NABH, it's just a switch over from their current largely paper-based system to a digital-based system. It has to move to a paperless system. Power backups, your antivirus softwares, firewalls that have to come into it. The digital operations have to be managed by qualified people. You need a policy for that. An IT policy is required for the hospital. Right from your emails to be given to the staff who all are qualified to access information. Because this is again patient data. We will have speakers talking about the importance of personal protection of data. It's a new law now in place with a lot of penalties in case that patient data is out. So this system also needs to be able to provide for that. Finance and procurement management, because this is linked to the entire billing, getting the bill out by the time the patient is out, online methods of payment of the bills for the patient, payments by the hospital to its suppliers. UPI being in place, this is all now very easy. But if this had come out about 4 years back, this would have been the biggest challenge that hospitals would have had to face. The human resource management as part of the hospital operations, because a large part of this is going to succeed if every single medical practitioner is also on board. They are also part of the health professional registry that's going to be in place. Qualification of nurses. Good NABH hospitals already have that in place, but now they need to be able to show that, and it should be on record too. And the information management system needs to follow classifications which are internationally accepted. It needs to be as per SNOMED, WHO ICT 10, which is the latest that has to be used. They've put this in the NABH standard itself, so there is now no escaping it. The hospital data will need to be in an easily recognizable form so that it can be passed across. Any hospital which has a standardized HMI system should be able to access it and read it. DICOM standards for imaging. Today, 80 to 90% of hospitals are following it. But now it's getting mandatory that every single hospital in the network, which is maybe Ayushman has about 30,000 hospitals in its network, I guess. Now we are talking about not just the big hospitals, even the medium to small hospitals also being forced to come along on this. Focus on the standards and the benefits. Focus still remains on patient safety, because if you have such a transparent process, the patient safety is paramount. It gets ensured automatically. And access, primarily. The entire digital health is to ensure that easy access is available to the patient wherever he is. Because tied up with the digital health standard is telemedicine. They've said that telemedicine option has to be there with every hospital. The patient can opt for a telemedicine or an online or a direct consultation at the first level. Mobile health applications. A very good quality HMI is in place. Parallelly, the ABDM is also insisting for every single HIS supplier, EHR supplier, EMR supplier also to get accredited, which means their systems have to be, and that's also part of this very elaborate plan that you all have drawn up. It's quite remarkable in the very short span that this has been done. We've seen all this happening just actually over the last 1 year. Maybe it's been working for the last 4 years, but to the public it's come out just over the last 1 year. Electronic health records, interoperability, the key of it, has to come from a recognized vendor who is accepted, because they need to use the same software that can be understood. Telemedicine has been brought into the standards, which means every hospital will need to have a telemedicine system in place. How elaborate will depend upon how much they would like to provide that on. But at least basic initial consultations, continuity of care, the patient need not come back, especially in geriatric cases. They're talking about a lot of requirements that telemedicine needs to bring into it. Virtual consultations, again very important for rural health. The specialists don't move out of the tier 1 and tier 2 cities. So if you have to see a gastroenterologist in a tier 4 or tier 5 city, there is no other way other than virtual consultation. The government, ABDM and the NABH is making that part and parcel of every hospital's functioning. Second opinion service. Yes, telemedicine has been doing that for some time, but this gets quite formalized. Because the same doctor who is going to, you're taking a second opinion from, with your consent can access the records. They can see that too and then give an opinion, maybe contrary to what the first physician has said, but then that's acceptable. Today, the patient is also the consumer. So he gets the option to weigh his choices before going in for the next. Informally, all this is happening. But now this is allowing it to be done in a far more formal way. Patient portals, many hospitals do have it, but they want these patient portals now to be far more engaging. With a lot of wellness tips also coming along, personal health information, appointment scheduling definitely. Payments to be made through the app itself by the patient. Somebody was talking about when can I ever start accessing my own personal data. This is making it possible. You will have the patient portal, you will have the app also available. This is your right to be able for the patient to be able to access his data and then decide with his consent whether he needs to show it to the next provider or not. A broad breakup, very similar to the main 5th edition standards. The number of objective elements and standards are much less, but the structure is broadly the same, which means we're just talking about converting the entire system to a digital platform. Objective elements just are quite similar to the latest 5th edition. And for everyone's information, it is the core elements that they are now mandating. The commitment and achievement levels can come along by first year and second year. A breakup of the standards. The evaluation process is quite similar to the earlier edition of the NABH, where they went for a 0, 5, 10. The current edition is actually just a 0, or pass or fail. Well, now this is quite similar. Maybe this is the first stage, later on they could also start getting a little more into that. Silver is the level which normally any hospital would first start with, and I'm sure that would start happening once Ayushman announces it formally and says that this is part of being on the Ayushman Bharat portal. In silver level, the core elements have to be compulsorily met, and on commitment 60%, which gives actually some time for the hospital to upgrade and get on to the next stage. Gold level is the next. Maybe a very good private hospital could aspire, but mostly everyone would go on this level, and by after about second year move on to gold and then on to platinum. Surveillance is quite similar to the NABH. It's valid for 3 years. Surveillance assessments every 18 months. That's all. Just a quick bird's eye view. The standard is very large, and I really need a whole day program actually to understand it.
In fact, just to reiterate, not to scare any one of you in the room, because we have been part in terms of building that. The standards or objective elements, if you really read it, are kept very, very simplistic and minimalistic. You can quote me literally on that. In fact, we did get some feedback that maybe the objective elements are just too simple, because our entire intent was that every care provider, be it, and repeating, be it a 10-bed center, be it a 1,000 bed, should be able to get on that standard. First point. Second point is the standards have to be linked in conjunction with the 5th edition. So you have the 5th edition, the NABH, which I'm sure that most of you in the private sector would have had that. Now this is the digital health standard. And the next standard that we are building currently is a standard to measure the maturity of all HIS and EMR in India. So it will be like a troika, operational standard, a digital standard, and EMR standard. And all of you can be proud to say that India will be the first country in the world to have such a troika. So we should all give ourselves a pat that whatever we have been working is in the right direction of digital health. There's one very key aspect that is there on everyone's mind, that how secure is my data? Will my data get stolen by competition, which is the hospitals talking about? Or patients to say that, will my data get sold to agencies? And in that respect, if you have followed the last 6 months, 7 months, I think, and kudos to the government, really, and we can't, again, I'm not a government agent out there sitting out there, but the vision that they have, the recent Data Protection Act, which has been passed by both the House of the Parliament, is a revolutionary one, and which was really the need of the hour if you were to think about it. So the responsibility of protecting, ensuring the safety of the data that gets captured, digital data what I'm talking about, and ensuring that it is only used for the purpose it is really with the person who is, or the agency which is capturing it. So I will let Vikram maybe delve a bit more that how does this act is intertwined in terms of all that we have been speaking, right from the basic foundations of ABDM, the NE-based digital standards, and very importantly, how do we need to be gearing up for it? Thank you.
Thank you. I will just start with 2 examples. I'm from Jaipur, and I was talking to this pediatrician who runs a small clinic, and I asked him out of curiosity, do you use any software to write prescriptions? And he told that, oh, I was using this XYZ, but now I am not using anything because I think that they use my prescriptions and then they approach the patients to provide some concessional tests or they do some hanky-panky, and I am not very comfortable with this. So when it comes to digital health, or when it comes to health data, this Digital Data Protection Act would be very useful. In countries like the Europe, we have the GDPR. In the US, we have HIPAA, and we have various other acts. But till now, before August 2023, we did not have a formal statute that protected data. So one of the most important feature that has happened in the present time is that it has been recognized, yes, that the personal data of individual, it is to be protected. It is worth protecting, and government would regulate the processing of that data. And if you would have seen the Digital Personal Data Protection Act, I would request everybody to have a look at the act again and just read the illustrations. The act is also, those of you who think that law is complex, it is also an example as to how do we make a law which is very easy to communicate to non-technical people. It has various illustrations, and it says that suppose I go to a restaurant and I give my mobile number, that mobile number is to be used only for the purpose of giving me my order. It is not to be used for any other purpose. So very, very what you say, forward looking act. And definitely when it comes to data protection, we were having an interaction with the officials from the Netherlands, and the minister himself told that when we were sitting in the parliament and enacting their Personal Data Protection Act, everybody was talking about health, because when it comes to your photos, when it comes to your other finances things, people are very open. They generally don't have any problem in sharing it on Instagram, Facebook, Twitter, LinkedIn. But when it comes to health, this privacy has to be there. So with this, we'll have more protection. Our digital mission, the Ayushman Bharat Digital Mission, it was based on the National Digital Health Blueprint, and the contents of the blueprint and the contents of the act are roughly similar. And so now if any software or any hospital which has to comply to the Digital Personal Data Protection Act, if it complies with our Ayushman Bharat Digital Mission standards, it would automatically comply with the act. Another thing is that another provision in this act is that the data fiduciary, for example, most of you are from hospitals or care providers, it gives the responsibilities on the data fiduciaries, that is the persons who collect the data, to provide a summary of the data that you have collected. For example, if my lab report is collected by you during the past XYZ years, you would have to make it available to the patient digitally. And if you have to comply with that, maybe you won't have to send emails or send SMSs. The moment you become the Ayushman Bharat Digital Mission compliant, automatically when you save that record in your system, a copy of that would be available automatically to the patient. So what we are motivating every hospital is that if you have a software, you please check whether it is ABDM enabled or not. You can check it on our website. We have a partners page, and the list of all compliant HMISs and LMISs is reflected there. If you do not have, then what we have also done, similar to the work that Menon ji was mentioning, is that we have created a very simple system like the one when we go and buy air conditioners. So when we go and buy air conditioners, we see that, oh, this is 5-star rating, this is 4-star rating, this is 3-star rating. So for hospitals and labs, to encourage them to easily understand which software to buy, there are about 2,500 different software in this in our country. So we have done a small exercise where we have rated, given star rating to the software. So probably that can also be a useful feature for you. Over to you, Sayantan. Yeah.
No, I think it's the way it was articulated. So if you think about it, that we spoke about ABDM, which is, and what is there for each of you as a provider, if I were to say, that you need a system which can help you get on that ABDM bandwagon, which is what Vikram was mentioning about ABDM compliant software, which needs to then be able to create what is known as the Abha ID. Like all of you would have heard about Abha ID, which is the health identifier. So that becomes the identifier which is used to identify each and every citizen of India. you need your facility to be what is in the registry, which is known as HFR, which is the Health Facility Registry, so that you register your facility, or if you have multiple of them on that registry. Third is having each of your doctors, physicians, caregivers enrolled on what is known as the HPR, which is the Health Professional Registry. And by doing what you are enabling is your entire setup gets on that ABDM platform that we are talking about, which is safe, secure, and the way to go about it. And what goes hand in hand is the new data protection bill that we spoke about. And what we spoke about is the NABH digital standard is the enabler which is given a vision, because if you read about it, the silver, gold, platinum, what it really gives is almost like a roadmap, because we talk about, a lot of hospitals say that, hey, what should I be doing in the next 1 to 2 years? It gives a vision. So the core objectives are something that you start with and then you build on. So if you think about it, all of these three that we have been talking about go hand in hand. So please don't think about that these are additional burdens that we are being getting. It is the guideline that we have currently. And I will have Dr. Manikandan talk about that from a Tamil Nadu point of view, from a state point of view. And it will be really useful for each of us to understand that what is happening on ground, what are some of the initiatives that the state government has taken up, because health is a state subject. Over to you, sir. Thank you.
Good evening to all of you. Glad to be part of this Tamil Nadu MedClave being organized by CII. Thanks for the opportunities given to be with you today in the evening as a part of the conclave. I am myself expert advisor as a part of the Tamil Nadu Health System project, which is executing the Ayushman Bharat Digital Mission in Tamil Nadu. Government of Tamil Nadu has already approved the implementation of ABDM in the state based on the guidelines given by NHA, National Health Authorities. And we have a lot of work to be carried out. It's a challenging one, as indicated by Chatterjee. The three foundations, the ABD, the ABA ID and HPR, the professional ID, and facilities IDs have to be, registries have to be created. So these forms as the foundations of the ABDM. These registries are stored in the NHA side and the NHA side. The other aspect is the medical records, which are very much important, based on which the paperless medical records will be made available to the patient, to the citizen, whenever he visits the hospital. So linking of these applications, health applications like the HMIS, laboratory information system, the other clinical health applications have to be done in 3 stages, as identified by as indicated by the NHM. There are some guidelines are given. There is a test platform is available in which the testing environment is carried out. After it is tested by and approved by the ABDM people, this is made available for use on the live platform. So the applications will be made ABDM compliant. Then whenever the patient goes to the hospital, he first gets registered with respect to ABA ID if it is not available. If it is available, that gets stored as a part of the HMIS or any other system that is available. Then the patient visits the doctor. Doctor, based on the ABA account or whatever the health account that is, mobile number that is available, he talks to the patients and understands the issues related to the patient. He prescribes. That details are recorded against the ABA account in the application system. Then whatever activities are going on, that is getting recorded against the ABA account. Then when the patient is admitted, again activities going on in the ward as an inpatient till its discharge, that is also recorded. So this is happening at one particular hospital. Same way the patient goes to another hospital, whether within the state or outside the state. These records are collected and stored against ABA account number. So this way the record is available on a chronological order. The important point here is the records are not stored at the central place with respect to medical records. It is stored if it is a hospital, private hospital, in the server location, or it may be a cloud or local physical may be stored there. Only the linkages with respect to ABA account, the hospital facility is visiting, the doctors is seeing, these records are stored at the NHA side. So there is a linkage is established using the network that is available. By using the above account, the data are collected and thrown wherever it is required. This is a speciality of the system that is being planned here. With respect to Tamil Nadu is concerned, we have formulated a project management duties which is taking care of the implementation of the ABDM project in Tamil Nadu. See, we have a mandate with respect to ABA ID creation that we have to cover all the population in Tamil Nadu. As per the 2011 census, it's around 7.2 crores of population to be covered. It's a mammoth task to be carried out. The ABDM site, is a one way by which ABA account can be created based on Aadhaar ID. And Aadhaar ID is given, the OTP goes to the mobile number where it is registered. Then if it is accepted, then the data will be, your data will be thrown. Then if it is confirmed, then ABA account will be created. This is one process. If like this, all the citizens will have to create. So far, we have around 81 lakhs of ABA IDs have been created. And even when the HMIs, Tamil Nadu is running an HMIs application in all the hospitals, in the district hospital, sub-district medical college hospital, the registrations are going on. Daily around 2.5 lakhs of registrations are going on. The application is, we are testing it to make it ABA compliant. Once it is made ABA compliant, the ABA accounts will also be, ABA IDs will also be created over there, followed by the medical records, storage, and subsequently this work is going on at present. Now, my request to all of you who have come here, those who have created it is fine. Those who have not created, please create. There is an abdm.gov.in site is available. It is a simple. It is even less than few seconds it will be taking. You can give your Aadhaar card and you should have a mobile number. Then OTP will be coming up. You yourself will do. Either you would take the help of your sons or somebody else, you can do it. You can do it for your family. You can tell your friends to do it. So that by word of mouth, the ABA account can be created. Because this is a mammoth exercise. This has to be done not in one day. It has to be done over a period of time. There are 60 partners applications are available in the ABDM site by which the above accounts are created. The ABDM site is one such site which is being created. The HMIS application, wherever it is made ABA compliant, through which the ABA accounts are created. Similarly, you have a CoWIN sites. If you go to the dashboard.abdm.gov.in site, all those things will be available. This is one exercise which I would request all of you to do. If you are a medical professional, in addition to ABA, you have to create a HPR, that is health professional account, which is necessary, by which if you are private practitioner, this has to be approved by the medical council concerned. If you are working in the government, this will be approved by the verifiers appointed by the government in the respective districts. So this is another exercise, so that by which your registrations are authenticated. And again, HPR registration also based on Aadhaar card. So there also OTP will be coming up. Based on the OTP, your HPR account will be created. Third one is the facility registration. This is concerned unit heads of the concerned hospitals how to do. They should have an HPR account, and once the HPR account is created, there is the formalities are the data, what are the data to be entered will be available, which is self-explanatory. Within 3 to 40 minutes, you will be able to create it. So once these facility account, professional account, ABA accounts are created, basic foundations are established, which are essential to collect the medical records when the patients visit the concerned hospitals. So I would request all of you through this forum, please help us to create ABA account and also professional account and also facility account. Please be part of the ABDM system, so that in the longer run, the system will be made in a useful way to achieve the objectives. The other one is the facility whichever you are running, many applications that are running has to be made ABA compliant by following the 3 stages of validations. M1, M2, M3 is already available, and you have to register in the sandbox, that is a test environment in the ABDS system, by which once it is tested, this will be made approved, then it will be made ABA compliant. This is very much essential so that your application will be declared as ABA compliant. You will be given a certificate also from the ABDM, based on which you can show that application is ABA compliant. So this also we are promoting in the government setup wherever it is possible. Soon you will see the hospitals running HMIS application, other applications will be ABA compliant. You will, whenever you go, wherever footfall is there in the government institutions, the ABA accounts will be created, facilities account will be created, professional registers will be done, and medical records will be created. That is going to be order of the day. If not immediate, is going to be in the times to come. This is one thing I would like to tell you from the government side. From the TNHSP side, we are taking every efforts. We are planning to cover all the government agencies throughout the state. And with respect to private setup, government cannot get into directly the implementing the activities in the private. So ABDM brought out a concept called microsite project. So in which the selective taluks will be identified, and all the institutions available in the taluk, in the area, will be registered. The medical profession will be registered, and the patients who are coming will be registered. The applications will be made compliant, so that in that area all the institutions will be covered. So then that way the private establishments will be brought into ABDM compliant, because government cannot go each and everywhere by covering private. So microsite project has been brought in to cover the private establishment, that we are expecting to launch sometimes from in the next year, from January onwards. We identified some pilot districts which we are working with as per the guidelines of the ABDM. We are identifying the partners. The partners will be identified. There will be an implementing agency will be there. They will also be identified. These people will be interacting together, and government will act as an agency to monitor. It has to be done within a period of 6 months to 1 year, to implement this microsite project in the selected pilot districts. Once the pilot is successful, this will be extended across all the taluks in the state. This has been planned. Already this work has been started in Maharashtra, Gujarat and AP, and the similar line we will also be starting this. But with respect to registration of the doctors, with respect to the facilities, we have a long way to go. There are around 34,000 establishments are available as per the repository register maintained by the Government of India, Ministry of Health, and out of which only 329 establishments have been registered so far, which is very small number. We have to register. This covers both private and the government. We have to register all the established in the there are some institutions may be left out also. That also will be covering out which are left out. So I request all of you through you to come forward to register your institutions wherever it is possible. And similarly, the doctors, through you, inform your colleagues, inform your friends, doctors, to register them as a part of the system. And I am here in part of the health department, the DMS complex. My number will be available. I think you can take whenever you want any information related to ABDM, please feel free to contact me. I will act as a bridge between you and the ABDM. Wherever it is possible, I will be able to help you to give clarification. Wherever it is required, I will get in touch with the ABDM Delhi to clarify your issues, and this can be sorted so that we can move ahead towards in the right direction that is required. So, Government of Tamil Nadu has got a...
You can see more details on our website, and they can get in touch.
Websites are available, ABDM site you can see. The guidelines are available, tutorials are available, video files are available. You yourself can see. The registration will be very, very easy to do it. So that way you will be able to go through and understand. So with this, these are the development that have been going on, which I have shared with you. And the future, as and when things coming up, we will also be sharing it through the medias that are going to take place in the government. Thank you for the opportunity. Thank you.
Thank you, sir. Just one question. How many of you do you have an ABHA ID in this room? Do you know others?
So only very few.
How many of you got your COVID vaccination done? So all the people who raised their hand right now, I assume it was through the CoWIN app, you have an Aadhaar ID. So that's how intuitive it was, and that's how inclusive it was. The intent was not just to say that, but that's how fundamental an Aadhaar is going to be. Like Aadhaar has become fundamental, right? Nowadays, we can't even imagine going to any shop without a UPI or an Aadhaar. That's exactly how an Aadhaar is going, if not already part of our life. So we have, I think, run out of time. So we maybe take a couple of questions if it's okay, or if there are any. If there are some raised hands, we have, maybe can we have a mic over there? Yeah. Is there. Go on, sir. Thank you.
Thank you and congratulations for enlightening us with the entire movement towards digitization and digital transformation of healthcare, which is very important. If I may ask the question, my name is John, and if I may ask a question to you, Dr. Pagaria, are the architecture of the entire health digital data, are you basing it on the consent-based architecture? And what would be the role of fiduciary in this? And would the fiduciary be the same as RBI has already allowed, or would there be a separate fiduciary created for healthcare sector? Thank you.
The first part of the question was consent. Yes, it is based on consent very much. Whenever the patient says yes, then only that data would be shared. And we have granular consent. For example, if I want to share my data, then I can say that I want to share 1, 2, 3, 5, 7th record. And I can also say I want to share it for the default duration is 6 hours. You can change it to 2 hours, you can change it to 1 hour, you can change it to 24 hours. It is your prerogative. And second was in relation to data fiduciaries. I am not sure about the data fiduciary setup of the RBI, but the data fiduciary of the Digital Data Protection Act, we are the hospitals and the software. They would be the joint data fiduciaries when it comes to the digital health space. So if there is it is Apollo Hospital which is using some vendors software, so both of them would be the data fiduciary, and they will be responsible for protecting or avoiding any data breach. Yeah.
Any other questions? Else, I think we are available offline. Oh,
thank you, respected members. Small question. Assuming that ABDM compliant hospitals, please educate me on the term digitization of clinical records, which means is it a scanned copy or a PDF file or HL7 or Loinic complaint? Why I am asking this question is, suppose I want to mine and extract only images related to myocardial infarction out of millions of images. Can I do that with the current standard?
It's a good question. I'll just say that what ABDM has presently done is the level of digitization of the health ecosystem is at a very formative stage.
Okay.
So we comply to the FHIR standards,
okay,
which are the international standards and are an offshoot of the HL7 standards. But right now what we have done is we have reduced our compliance to unstructured and structured data both.
Okay.
So for example, if there is a migrant worker who is from say UP working in Chennai and she comes and she has a problem, then even the records of her scanned records of the hospitals from Uttar Pradesh would be visible.
Good.
So if they are digital, they would be they can be OCR'd and they are machine readable. More processing can be done.
Yeah.
But our system is inclusive. We promote structured data, but presently we are okay with unstructured and structured both.
Thank you, sir.
okay. Thank you. Thanks, everyone. I don't know if we have time. We have just, I think,
I have one. Good evening, members. I'm Sri Vidya. I'm a co-founder of dissected Solutions. We have just developed a ABDM compliant clinical management system. So I am a researcher in IIT Madras, and the thing is, like, I have a question to Dr. Manikandan sir. Okay, Dr. Manikandan. So Manivannan sir. So Tamil Nadu has a population health register, right, for everyone. So how it is getting merged with the ABDM? Does citizen has to have maintained two IDs, or how is it?
No, what we are doing is, see, the total population covering it will take a lot of time. We
Okay.
have a ration card data, which is also, that data is more equivalent to cover the mostly all the populations, which data is taken and it is passed on to the other database, and whichever is matching, based on which other account will be created. And so that you need not wait till the patient comes to the hospital and ABBA ID is getting created. That is what has been done in many other states also. Same way we are doing it. We have done similar way with respect to the insurance database, which is being right now available, which is linked to PMGOI, where the Tamil Nadu CM insurance scheme is being implemented. So that the same way we'll be following with respect to the other population. It is not completely covered, partially it is covered. Still we are working with the ABDM Delhi and to trying to cover all the populations. So without waiting for the entire population to be covered.
So we just received funding from Startup Tamil Nadu, and how can I get contact with NHA Tamil Nadu team so that our product will be helpful for understanding the ground entry of the PHR?
You can talk to.
Maybe what we can do is which is available offline after this.
Yeah. Okay.
Right, after the session, because sorry, we had to
Okay,
just
thank you.
we are really run out of time. And thanks once again for all the panel members. And because there's a discussion, as you said, we can take a lot of time and all. And thanks for a lovely audience here. Thank you.
Thank you very much.